Hi, my name is Kelly Armstrong, and I am going to walk you through how to set up your vagal stim protocol for a patient that is left ventral dominant. So these patients may have inhibitors such as torso scars that will inhibit the left ventral vagus nerve. So to start, we're going to get your one dolphin. We're going to put the pad, the oval pad, onto the thumb plate. We're going to get the white connector wire and connect the two pads. Okay, so nice and firm in there. And then we're going to take the rectangular pad and hook it to the connector cord also. So now we're going to take our pad and we're going to place it right below the belly button. Okay, and what this does, this is at the bottom of the vagus nerve, and it's going to help to pull and strengthen that electrical current. Okay, so I want you to make sure that you have your device set on negative and on the dry setting for the skin type. We're going to take the black cap on the cord and put it right over the tip of the dolphin, nice and firm. And then I'm going to take the other end of the black cord and place it right into the ear clip. Okay. So now I'm ready to clip this on to the left ear. So I'm going to take an alcohol wipe. I'm going to moisten the ear clips for good connection. The tragus of the ear. I'm going to hook that up. Okay. And then I'm going to turn my device on. I want my light to go out, and then I am ready to treat. So here I'm going to treat for 5 to 10 minutes on negative on the left ear. When this treatment is done, I'm going to turn my device off. I'm going to unclip the ear clip. So if you'll turn your ear over, I'm going to re-establish connection to the right side. I'm going to change my setting to positive, leaving the dry setting. Now I'm going to turn my unit back on. The light goes out. I'm ready to treat. After 5 to 10 minutes, we're going to turn the device off, remove the ear clip, and this is how you treat a ventral dominant client. So you are balancing 5 to 10 minutes on negative with the left ear, 5 to 10 minutes on the right ear on positive.